Hi, my name is Kendra Julian, and I'm the Adolescent Immunization Specialist at the Partnership for Maternal and Child Health of Northern New Jersey. Today, I'm going to be talking with Dr. Shalom about pneumococcal and the vaccine. So, Dr. Shalom, could you introduce yourself?
Hi, my name is Everett Schlam. I'm a faculty over at Mountainside Family Practice in Verona, New Jersey, and I'm the chair of family medicine at Hackensack University Medical Center. I'm glad to be here. Thanks for inviting me.
No problem. Thank you for joining. So I just, wanted you to give us a brief understanding of pneumococcal, the vaccine. What is pneumococcal, also known as pneumonia? How is it transmitted? Who should get this vaccine? The importance of getting this vaccine, especially during this time of COVID.
Pneumococcal disease is caused by a bacterium called strep pneumonia. This bacterium, strep pneumonia, can cause infections like a sinus infection or an ear infection, or more serious infections like pneumococcal pneumonia, an infection of the lungs, bacteremia. The infection can get into your bloodstream, and even meningitis, where the infection causes serious infection that lines the fluid of your central nervous system, your brain and spinal cord. So pneumococcal disease is relatively common, and getting the vaccine can help prevent these serious complications. There are two pneumococcal vaccines. Mm-hmm. There's the Prevnar 13 that prevents infections from 13 of the serotypes of pneumococcal disease. There's over 90 serotypes of pneumococcal disease. So the Prevnar 13 prevents against 13 serotypes, and the other one is the Pneumovax 23 that prevents 23 of the serotypes. Mm-hmm. So the Prevnar 13 is given to children routinely. 2 months of age, 4 months of age, 6 months of age, and between 12 and 15 months of age, and then to certain individuals with high-risk conditions. The Pneumovax 23 is given to people with high-risk conditions and routinely over the age of 65.
Okay. Wow, that's really great information, good feedback. So who would be at risk for, getting pneumococcal? And how is it transmitted?
So pneumococcal disease is transmitted from saliva, mucus, respiratory secretions from person to person.
Okay.
The people at highest risk for pneumococcal disease is children under the age of 2 and adults over the age of 65.
Okay. But
there are certain groups of people that are at very high risk for serious pneumococcal disease. Those would be people who are immunocompromised with HIV or getting chemotherapy for cancer. People with sickle cell disease, wow. People with cochlear implants, and people with chronic disease of their heart, their lungs, their liver, their kidneys.
Got it. So just like the flu vaccine, they recommend of getting the flu vaccine every year. Is that the same with the pneumococcal vaccine?
Actually, no. The pneumococcal vaccine is not given every year.
Okay.
So an otherwise healthy adult at the age of 65, the doctor will discuss with them. Some adults get the PCV13 and a year later get the pneumococcal 23.
Okay.
Other patients, your doctor making a shared decision with you may decide just to give you the pneumococcal 23. That's a one-time vaccination. You don't need to be revaccinated. If you have a high-risk condition, say chronic lung disease, you're a smoker, right. You have heart or kidney disease, those patients would get it before the age of 65 and then be revaccinated if it's been at least 5 years later at the age of 65. But not everybody needs to be revaccinated.
Okay, and how safe and effective is this vaccine?
It's very safe and very effective, specifically most effective in preventing severe disease.
Okay.
So for instance, we rarely see severe pneumococcal disease in children under the age of 2 because we do a very good job immunizing these infants. So 8 out of 10 infants who receive the PCV13, Prevnar 13, they will not get pneumococcal disease if exposed.
Got it.
And older adults over the age of 65 are high-risk conditions. About 7 out of 10 of them, if they're exposed to it, won't get it if they get the pneumococcal 23 vaccine.
Okay, got it. And what would you say, how would you, be able to distinguish between the flu and pneumococcal?
Influenza and pneumococcal disease can be difficult to distinguish.
Okay.
But influenza causes significant body aches, also cough, fever, chills. The most common serious disease caused by pneumococcal disease is a pneumonia. And the most common symptoms of that are cough, fever, chest pain, and difficulty breathing. But the symptoms can overlap. And it's essential to get your influenza shot because many people who get influenza and get influenza pneumonia, they can get a complication called secondary bacterial infection. And one of the causes of that is pneumococcal disease.
Wow. Okay.
So that group can benefit from both an influenza shot and a pneumonia shot, and you can give them at the same time.
Got it. Well, that's good. That's good to know. And how would you address, with all that is happening, and the misconceptions and misinformation about flu that we've heard over the years, and I mean all of the other vaccines, how would you address vaccine hesitancy, especially since we're in a pandemic and we know that it's extremely important to get vaccinated? I mean, here we have these vaccines that could protect us against from getting pneumonia or getting the flu, right? How would you address vaccine hesitancy?
Well, these vaccines, including influenza and pneumococcal vaccine, are very efficacious, and their side effects usually consist of low-grade fever, injection site reaction, which includes pain, redness, and swelling at the injection site. Some patients may get a headache, fatigue, or some joint arthralgias or myalgias. Most people get none of those things. A small percentage do, but those symptoms usually resolve within 24 to 48 hours. So it's very well tolerated. We're very careful monitoring for vaccine side effects. So these vaccines have been around, including influenza and pneumococcal vaccines, for many years. You cannot get influenza from the influenza vaccine, and you cannot get pneumococcal disease from the pneumonia vaccine. They're very safe and effective, and the risk-benefit ratio, much more benefit to small risk. So I'd strongly recommend everybody getting those vaccines.
That's good to know. And you did mention that both vaccines can be given at this during the same visit.
They can be given during the same visit. Now, influenza vaccines need to be given every year because the strains may change.
Okay.
But pneumococcal vaccines, they're usually given, for the vast majority of the population, they're only given once.
Right.
Except for infants in that initial stage. High risk people, usually 2 vaccines separated by 5 years. So those you don't need to keep re-immunizing with pneumovax, but you do have to do a yearly vaccination with influenza.
Okay, that's really good information to know. Well, I'm happy that you were able to, address these concerns about, pneumococcal vaccine, as well as, including some information about flu in there. But what about, addressing some concerns, in the times that we're in with COVID? Being in the pandemic, what are some things that you would like to share with the community with regards to COVID and all of this being like respiratory issues and dealing with this, and a lot of people having this fear of getting vaccinated?
Kendra, I appreciate that's a very timely question because, of course, the COVID-19 pandemic has hit globally everyone very hard. And it's more important than ever for patients to get their influenza vaccine because the symptoms of influenza can mimic those of COVID-19. The same with pneumococcal disease because that can cause a secondary bacterial infection if you happen to get COVID-19 or influenza. So it's more important now than ever to get influenza and pneumococcal and make sure you're up to date with your pneumococcal vaccine status. As far as the exciting new COVID-19 vaccines, which we expect to get emergency use authorization very soon, the efficacy of those vaccines is very, very good. 95% in preventing infection. And the side effect profile is good. Yeah. So I'm very excited that these vaccines that we really need to, healthcare providers and high-risk populations like the nursing home will probably receive them first. But in order to end this pandemic, we really need to have as many people vaccinated as possible as the vaccine becomes available.
Yes, I definitely agree with that. And, when you're thinking about when they're developing a vaccine, how would you say, we talk about the safety and the effectiveness, right? But how often do they monitor the safetiness of the vaccines? Because I think that's a concern that the community often has. We often explain to them, oh, it's safe, but does it go through extensive safety? Are they still monitoring it from a year from now? How does that work?
That's a great question. So vaccines are vetted very, very carefully for safety. So these trials are enormous trials of 30,000, 45,000. So they're very carefully monitored for side effects. And so we know before a vaccine is used in the general population that it's safe and that it's efficacious. Even after it's out, so what about rare side effects that are very rare, more than that you wouldn't detect in even a huge study like that? So there are many ways that we check for that. There's the vaccine adverse event reporting system. That's a system where the doctor, the patient, somebody, they can report a side effect that they get, and that's carefully monitored by the CDC. There's also something called the Vaccine Safety Data Link. So that's prospective. That's some huge healthcare organization like Kaiser Permanente and others. They prospectively, they monitor patients over time after they get the vaccine, and then they look for side effects. Something very exciting with the COVID-19 vaccine, people who get that vaccine, they're going to be given a text, they're going to have it through their phone to monitor for side effects too over time. So we're going to have a huge database of potential side effects that we're going to be looking at when these vaccines come out.
Wow, that is really great to hear, and it's so reassuring to know that they have all of these best practices put in place, just to kind of remove that fear that a lot of people often have, especially when it comes to vaccines. I hear it all the time. The myths that are out there, people going on Google and coming up with their own information and all of that. So, having this live session today is extremely helpful. And I have one more question for you. Can someone get pneumonia and flu at the same one time?
Absolutely. So you can get influenza, and not uncommonly, you can get a secondary bacterial infection. And one of the most common causes of bacterial infections is pneumococcal disease. Wow. So it's not unusual to get both at the same time. And so that pneumococcal vaccine will help prevent against that the strains that are in that vaccine for the bacteria that might cause a secondary infection, like from a influenza or from COVID-19. Okay. So yeah, it's important to get both
vaccines, and that's great. And if there's someone who has ever had an allergic reaction to any of the vaccines, what proper precaution can they take?
Well, unless it's an anaphylactic, which is a very severe reaction,
okay,
these vaccines are, and that's very, very rare. Okay. These vaccines are very safe. So unless you've had a very severe reaction in the past, then we wouldn't want to give the vaccine. But that would be unusual, a very small subset of the population.
Okay. And then we still, of course, not because we're only in a pandemic, but we still want to encourage the use of hygiene, hand washing, and sanitizing, making sure they socially distance at all times,
Yeah, thank you for making that point. So vaccines, none of them are 100%. So wearing a mask, staying 6 feet apart, washing your hands, being very mindful of those preventive strategies is essential right now.
Right. And I feel like this is something that we continue to practice even after the pandemic.
Yeah, absolutely.
Something that we know, I'm not saying that we weren't well aware of that in the beginning prior to the pandemic, but it's fully emphasized now that we're in a pandemic. So
certainly heightened our awareness dramatically, correct?
Of course. Well, Dr. Schleim, I am so grateful to be able to, host this live with you, and I'm so happy that you were able to address the concerns, the questions. I've learned so much from you. I'm pretty sure, along with the other people that are viewing this live today, about pneumonia and addressing flu and COVID. I think we are in a time of uncertainty, and there's a lot of us who are unaware how vaccines work, how it's important, and why it's important, the safety and effectiveness. And I feel like you've addressed all of those questions. And again, I can't thank you enough for taking time out of your busy schedule. I know you, along with all of the healthcare professionals, you guys are extremely busy with all that is happening right now. So again, I thank you, and I appreciate the work that you do and the information that you provided for us today in the community.
Thank you for having me, Kendra, and stay safe.
Thank you, Dr. Stein. You too. Take care.
Have a great day. Bye.